So I chose the University of Florida College of Medicine in Jacksonville for a couple of reasons, actually. As a medical student, we have these diversified experiences where we work in the community and we work amongst academia. I was looking for a program that had a bit of both. So I wanted to be able to be exposed to all of the most up-to-date evidence-based medicine, be practicing that, and yet also have a hospital that was extremely deeply rooted in the community. So we really know our patients here. We know the community that we serve. So for me, this was the perfect hybrid for that.
What I love most about this residency is that it really feels like you can be tied into the community. We have such a diverse population that comes from so many different walks of life, but we get so involved with them in their different parts of the community, and it's just easily tied into that.
So our faculty have a very wide breadth of training, and they have the level of expertise such that they feel very comfortable and invested in providing a good educational experience for residents, medical students, fellows who come to train here specifically. And that opportunity to teach for them is not only good for them to teach, but also for us, we get an opportunity to learn from some of the best faculty around.
We have people who have done private practice their whole lives and are now in an academic setting. We have people who have been academic their whole lives and are just really dedicated to teaching. So we have, the academic teaching, the real world teaching, all coming together as one, and our faculty are very invested in what we're doing. I'm friends with pretty much all of my attendings.
So the learning experience here is, in my opinion, second to none. But I'm really grateful for the different sites that we have to practice in. So here at UF Health, we're able to see the underserved population, be able to unfortunately see a lot of things that present later in the course than they probably should, but that gives us a lot more experience. And on the flip side, over across the river at Wolfson, we see more private pay insurance patients, and we get to see that side of it. So we feel really prepared when we come out of residency, whether it's for outpatient, whether it's for the emergency department, or as a hospitalist. And I think that's the main goal of every residency, is to be able to prepare you to pass your boards and be able to be an excellent clinician.
So being a Florida native, I wanted to be a part of a program that was both close to home, as well as a program that aligned with my goals in terms of trauma surgery. I wanted to be involved in a program that was both diverse as well as inclusive of different backgrounds. And during my interview process, I felt that the University of Florida Jacksonville General Surgery fit all those requirements. Being a chief resident, now 5 years into my sort of career here at the University of Florida Jacksonville, I felt like I made the right decision.
The residency here, being unique compared to other residency programs, I would say is that you don't have a malignant institution where you can have an environment where you don't feel like you can ask for help, or an environment where you feel you don't always have the oversight that you need or the ability to provide feedback to your other co-residents and faculty. I think our residency program does a wonderful job of allowing the residents to kind of self-regulate the program and make sure that everyone is happy and getting the level of education that they need. And that was something very important to me coming here.
We're unique here in that we work very closely with all of our different cohorts, internal medicine, surgery, otherwise. And there's such a collegial environment between all of those people. Everyone here is happy to come to work every day. Residency is hard enough. You want to be working amongst peers.
Someone that is on the fence about coming to UF Jacksonville, I would pick here because of the location, as well as the type of training that you're going to get. This is a level 1 trauma center that's only at certain hospitals, and you also have the beach right down the street.
So Jacksonville's on the ocean. I've never had that experience before, and it's beautiful. There's actually a lot to do here and in some of the outskirt towns. I've been to Amelia Island, which is like an hour north of here, and St. Augustine, which is a little bit less south of here. Both gorgeous places to visit.
For nature lovers, this is heaven. So you can see, lots and lots of landscapes, beautiful beaches, rivers, unique bridges in architecture that, every day that I'm traveling and, driving back from work to home, I feel like, I'm just being on vacation on an island. So this thing really is enough for me to charge my batteries at the end of the day.
So pretty much what I would tell any resident at this point looking for residency programs is think about what kind of physician you want to be and what qualities are important to you. So, you know, whether it's research, advocacy, how you interact with your patients, all that kind of stuff. Think about what you want and then find a residency program that matches. And for me, it was UF.